Your birth plan. As you approach the final months of pregnancy, you become more and more uncomfortable. Think the increasing discomfort of the final weeks of pregnancy is actually a gift. It is nature's way of mentally preparing women for birth. Women reach a point where instead of being afraid of labor, they're thinking, bring it on, let's get this over with. Before having a baby, most women have never seen an actual birth. We've heard tons of stories. We've all seen women have babies on TV and in the movies. All these images and stories can make a person worry about the delivery. Birth classes can be extremely helpful in preparing women by explaining the stages of labor and how to best cope. They can dispel some of the mystery and alleviate some of the worry. Try to find a birth class that you feel comfortable with, one that has an approach that is commensurate with your beliefs and values. Some classes encourage you to write a birth plan, what you'd like and not like to happen during the delivery, such as an IV, epidural, etc. These plans let the staff know your wishes. A realistic birth plan can help you process the possibilities during labor. I've included a handout to help you create one. Use your birth plan to help advocate for you. Unfortunately, your baby cannot read your birth plan. Your uterus and pelvis can't tell you how things are going to go down either. So your birth plan is a statement of wishes. It does not predict the future. Remember in Module 3 when we discussed how important mindset can be? Your mindset can affect whether you see your delivery as a positive experience or not. Two women can have quite similar deliveries, yet have very different feelings towards their experience. Being flexible and adaptable will help you have a positive experience. Some women want to have as natural a birth as possible. Go for it. Do everything you can to have the experience you want. Sometimes, however, medical intervention becomes necessary for the health of the baby. Roll with it as best you can. Unfortunately, we aren't always the ones who get to choose how things play out. While you may have a particular idea in mind of how you'd like your delivery to go, our main goal is to have a healthy baby. This is also your doctor's primary goal, and for that to happen, sometimes intervention is necessary. Challenge the idea that being induced, having an epidural, receiving Pitocin, or having a C-section is a sign of failure. It's not. On the contrary, you just successfully became a mother. Ideally, healthcare providers should clearly explain what is happening in order to reassure the mom and prevent the birth experience from feeling traumatic. However, things can happen very quickly. Once the doctor decides a C-section is necessary, the focus of medical professionals as they transition from vaginal delivery to an operative one is to adapt as quickly as possible. They often do not have time to stop and have a full discussion. This can be particularly unsettling if you don't know how routine this transition is for hospital personnel or are unclear about what's happening. Hospital staff pride themselves on how quickly they can transition from vaginal delivery to C-section. That statistic is measured. Keep in mind that almost 30% of babies born in the U.S. are by C-section. Give the medical team space to do what they need to do. If the staff are in rapid response mode, it's because their focus is on bringing your baby to the world as healthy as possible. That is their highest priority, just as it is yours. Some women develop PTSD from a traumatic delivery. Keep in mind what may seem very upsetting to you might be a completely routine occurrence for an obstetrician. Let them know how you are feeling. If you were upset by what happened, process the delivery with them afterwards. Sometimes learning the medical reasoning behind their actions can clarify why they needed to manage the delivery the way they did. There is a medication called Prenatal, and if it's given within 24 hours after a traumatic delivery, it can reduce the likelihood of developing PTSD. If you think you have symptoms of postpartum traumatic stress disorder, find a therapist who's experienced in helping people recover from birth trauma. Reprocessing the birth story with a trained psychological professional who also has in-depth knowledge of the birth process can be extremely helpful. Some therapists have found particular success with a technique called EMDR, eye movement desensitization and reprocessing. Develop a plan of care for your baby before birth. Develop a plan in advance for caring for your baby. This doesn't need to be detailed and complicated. Making sure you have things generally set up and accessible will be hugely helpful. Think about how you want to plan to feed your baby, where he or she will sleep, where they will have tummy time, and where you'd like to change your baby's diaper. After you bring your baby home, you will see what systems work well and which don't. Tweak your setup and routine to make it as efficient and easy as possible for you. The smoother things go and the less effort required by a routine, the less draining it is on you. Periodically reassess your systems to make them as efficient as possible. There are often multiple ways to address any situation. What works for you may be different than what works for someone else. Listen to your best judgment. Watch and learn from your baby. As you listen to what I suggest, keep in mind that only you know what's going on in your life. You will know your baby best. Try an approach that makes sense for you. If that works, great. If not, learn from it and try something different. A lot of mothering is trial and error. If my advice contradicts what your doctor says, discuss this with your doctor. You may be in a situation in which my suggestions are not the best approach, or perhaps the doctor can modify their usual approach to make it work better for you and your baby. We're always looking for a win-win approach, finding what's good for you and your baby. Diaper changes. Create stations for changing your baby at home and away. It's also good to have both a portable changing mat and a place to change your baby at the bedside. Parents often spend a lot of money buying a beautiful changing table and later end up changing diapers wherever it's most convenient, the couch, the rug, whatever. The good news is that purely breastfed babies' poop doesn't smell bad, which means you can change your baby almost anywhere. Create a comfortable place or places in your home where you can feed your baby. A quiet place where they sleep is good. It's also good to be able to feed them where you can still be a part of things. As you get good at feeding your baby, you can do it pretty much anywhere, but it's good at first to have designated places that have any supplies you might need. Cloths for spit up or cover up, nursing pillows to elevate the baby to your breast, etc. Consider playing music nearby so you can both enjoy it as part of your feeding routine. Nighttime routine. This is one of the most important care plan decisions to make in terms of preventing postpartum depression. The easier and more simplified your nighttime routine is for the baby, the more sleep you will get and the happier you'll be. So the ease of the nighttime routine is paramount. Make it as efficient as possible. Try to arrange your room so that you don't have to get out of bed to feed or change your baby. To do this, you would need to have a co-sleeper or bassinet next to your bed. Keep the changing supplies nearby, perhaps at your nightstand. Have an adjustable and dimmable lamp stationed on your nightstand so it can light up the diaper area but not shine in your baby's eyes. If the bulb is too bright, replace it with lower wattage bulb. You want just enough light that you can see what you're doing, but not so much that it wakes everyone up. Supply this area with a changing pad, wipes, diapers, spare infant clothes, and diaper cream. If you're bottle feeding, keep a clean bottle with fresh water already in it. Keep the powder nearby and add it just before feeding. While your baby is still small, you may have to warm the bottle before giving it. You can keep the bottle filled with plain fresh water and electric bottle warmer. Make sure the warmer is not placed near the baby to prevent injury. It's really important that you not leave formula in the warmer for more than 10 minutes because bacteria can grow. These are my best suggestions in making the transition to life with an infant more enjoyable and bearable. The goal is to simplify everything and have workable systems in place so you can avoid additional stress.